So I'm going to share my screen. Okay. So as we go along, what I'm going to do is our intern may hop on later and help me manage the chat. But if you have a question as we go along, just raise your hand or say Pam, and we'll stop. And this is, I want this to be a good experience, a learning experience. So this is interactive. If you have questions, stop me. So what we're going to talk about today is we're going to define what the HIC is, or the housing inventory count. We're going to talk about the relationship between the HIC and the PIC, or the point in time count. We're going to talk about some of the 2022 HIC changes. We're actually going to go through a HIC form and how to complete it. Excuse me. So when we talk about the HIC, the housing inventory count is actually a point in time inventory, whereas the PIC count is a literal count of those that are homeless on that particular day. The inventory is how many units, how many beds you have available, and the PIC count is how many people were in those. So we'll talk a little bit more about the relationship. And so we're going to count in the housing inventory count all of those provider programs that provide beds and units that are dedicated to those people experiencing homelessness. We have some transitional housing programs that provide housing. However, for the housing inventory count, it must be that you have experiencing homelessness as a primary eligibility requirement. The housing inventory count includes also permanent housing projects, where at the time of their entry into that project that they were considered to be homeless. Okay. So for our region, actually there's 5 program types, but for our region, the types that we have are emergency shelter, transitional housing, rapid rehousing, and permanent supportive housing. So when we talk about the relationship between the PIC and the HIC, like I said, the PIC count is a point in time, like how many people literally counted in our point in time count this year is February the 24th, which is next week. And we do that through surveys. And I know John and Cohen have been reaching out to you and working with you on that. They're coordinating our PIC count this year. So those surveys provide demographic information and other information about special populations or special needs. And those are counted for the sheltered and the unsheltered. So the unsheltered is those that are literally on the streets, or like in encampments or other places not meant for human habitation. The shelter count is those that are in emergency shelter, transitional housing, and so we count those in our PIC count, and we also count those in our HIC count. So we use those surveys to inform our HIC count as far as how many people are there at that particular time on that day. And when we look at over here under the HIC count, you'll see a thing called utilization rate. So what HUD does is they take that inventory of how many dedicated beds, or what is our capacity that's listed on the HIC count, and compare it to how many people we actually had in those beds on the day of the PIC count. And that is equal to our utilization rate. So I have an example here. So our PIC count is actually on February the 24th. So as far as our HIC count, how many dedicated beds does a project have? Beds are equal to persons. So let's say a program has 20 beds dedicated to those serving experiencing homelessness. On the PIC count date, all 20 of those beds were full. So that would give us 100% utilization rate. If same program, if we had 18 beds, that would give us a 90% utilization rate. 10 beds, 50%. So HUD wants us to have at least the optimal, well, the optimal would be 100%, but HUD would like us as a community or as your overall to have a 90% utilization rate. So any questions about that before we proceed?
Pam, I do have one. Would that be based on our regular beds or our overflow beds as well?
That's a good question, and we'll talk about that more, but your overflow beds are counted separately. There's a specific section where it's in the HIC form and in when we input the data into HUD, it's separated. So it'll say how many overflow beds do you have. So you're just going to be counting your what they call total year-round beds for your emergency shelter. Okay, good question. Thank you. Any other questions?
I have one. Because we're a little bit different, being a domestic violence shelter. So we currently will house or shelter up to 10 adults and however many children that comes along with that. And so, I mean, I'm not sure how to count the beds, right? I mean, it's 10 rooms and however many people need to sleep in that room, we'll move beds in, we'll move beds out.
Right. I think probably what I would suggest is that you talk to Brandy about what you would say like your maximum capacity would be as far as that goes.
Okay.
Because I think last year your organization did report and they had a capacity. So I think you already have a set capacity that you would use, but I would just ask you to talk to Brandy about what that is.
Okay.
Okay. Any other questions? Does it make sense about when we talk about the PIT count, we talk about the HIC count? Does that make sense? I guess I want to make sure that when we're asking you to do all this and provide all this information, how those two work together and the purpose of that.
Yeah, definitely. Clear for me.
Okay. Okay. Any other questions or comments? Okay. So we're going to talk just a little bit about the 2022 changes to the housing inventory count. There have been additional federal funding sources, and when you fill out the housing inventory count, one of the questions is what federal funding sources, or we also have on their state funding sources that you can add, funded this project. And so they've added some specifically for the emergency housing vouchers. We have some for, we as a COC have typically always reported, or I know last year we reported the SSVF and the HUD VASH, but they have that as a funding source. And the public housing choice vouchers, both HUD VASH and non-VASH. They've also added a specific field for a comparable database that would be for Rachel, you and Tanya, as far as do you have a comparable database that you use because you can't participate in HMIS. So if you completed the housing inventory count last year, I know Matt did and Paul, I think, you will probably see some of a little bit of change in that. Okay. Questions about that? Okay. So now what I'm going to do is I'm going to stop sharing. We're actually going to fill out a form together. Okay. I told you it was going to be fun. Are you having fun? Okay. All right. So what I'm going to do is, all right. So this gives you some basic information. And so I'm going to send this to you via email. It's a form. You can just go in here. We're going to go in here and fill it out. And I'm going to ask for those of you that have different projects, if we could kind of use yours as an example. And then just save it and email it to me. Okay. Is that easy about how to do it? Okay, so the organization, Kim, because you're our emergency, one of our major emergency shelter programs, do you mind if we kind of use yours first?
That's fine. So would we, another question would be, would we be doing, of course, Benton County and Washington County separately?
Yes, if you look up here, do a separate form for each project.
Okay, got it. Okay.
Okay, so I'm going to do Salvation Army. And I'm going to do Fayetteville. So that's going to designate. And then, so right here, whoever the contact person is, as far as who we need to reach out to about any questions about the form, that's who we would like their name, email address, and telephone number. So what would this particular project for emergency shelter be called? Just emergency shelter?
Yes.
Okay. All right. Because you will have like Seven Hills, you have different programs. So with different names, because you provide different, yeah. So you'll have separate HIC forms.
That's
So
what I was gonna ask, if we'd have one for permanent supportive, one for to count our dorm and family transitional units, and then another for our rapid rehousing.
yes, yeah, that's a really great example. Thank you, Jessica. So however many projects you have that are different, and we'll talk more down here, you'll be answering questions about what type of project it is. So for each separate type of project, you will complete this. So we ask about the contact information, and then is your organization a victim service provider? So Rachel and Tanya will check yes there, and Kim will check no. Does your organization participate in HMIS? So for Kim, that is yes. And for like Tanya and Rachel, you would check no, and then you would check a comparable database for yours. If you don't use either, or you use HIC or anything else that you use to capture, I don't know, Solomon and Egypt, what type of software do you use to capture yours? Do you use HMIS? You do. Okay. All right. Just and I know for the veterans like Matt and Paul, then I think you use Homes. Is that correct?
That is correct.
Okay. So you would check other and put Homes in there. Okay. So this next section asks about your organization's projects. So project types here include emergency shelter, transitional housing, permanent housing. And so down here we have different categories. And so you'll look at what category is appropriate for this particular project that you are reporting on. So for this project, it's going to be emergency shelter, right? But we also have emergency housing assistance for SSBF. I don't think we had that particular funding type in there last year. Matt and Paul, I think that's something that was added specifically this year. I think we reported it, but it wasn't, we reported as emergency shelter, but it wasn't designated specifically like that last year. So we also have transitional housing. We have different types of permanent supportive housing, permanent housing. So we have the permanent supportive housing, we have rapid rehousing, and we have rapid rehousing, which is SSBF. We have vouchers that are HUD-VASH. We have vouchers that are emergency housing choice vouchers. Emergency housing vouchers.
So Pam, on the rapid rehousing, and that is to include only people who are housed and receiving case management at that point in time. Is that correct?
Yes, that's correct. And we'll talk more about that because as you pointed out, rapid rehousing and the reporting is a little different because the rapid rehousing, those that are actually in your program on this day are equal to your capacity or your inventory, whereas that is not the case for others. So yes. Okay, also this asks you for this project, do you have any inventory units or beds that are under development? And those are beds that are available at a future time. So Kim, do you have any beds that are under development?
We know what we are doing our renovation project. So I don't know exactly when we would be reporting future beds here. It hasn't started yet, but
Okay.
it's
Okay, so
it's a fairly definite go. So I don't, and
yeah, you would
No.
probably check no until, because the thing would be is like how many specific beds are under development. So maybe if you want to talk to Captain Robnett, you can talk about if you want to include that or not. But we're going to do no for this particular one, okay?
Okay, for Rachel and I on that question,
Mm-hmm.
because we aren't utilizing all of our rooms right now, like,
Mm-hmm.
would it still be a no for us?
Mm-hmm.
Because they're, okay,
Yeah, this is new beds. So let's say you are currently developing, or you're expanding your shelter to include a room that has 5 more beds, and you anticipate them being available in the next 6 months. So they are currently being constructed. So you would do yes, and then however many units and beds. So it would not necessarily be an additional unit, but it would be an additional 5 beds. Does
all
that
right,
make
thank you.
Does that make sense?
It does, thank you.
Okay. Okay, so now this next piece asks about your current inventory and your housing type. And this is where, when we looked earlier at the utilization and comparing those, this is where we get that information. So, and there are different housing types. So you will only choose, I'm going to scroll down and then I'll scroll back up, but you will choose the ones that apply to your particular project. If they don't apply to your project, just leave them blank. So this is a form that can be used for all projects. So for Kim, for emergency shelter, I think you serve adults and children with at least 1 adult and at least 1 child, right?
right. Good question that came to mind is, how do we handle the family rooms?
Right.
It's a little bit different each location, of course, but they might have 1 adult in there, they might have 2, they might have,
Right.
Various number of children.
Right. So also let me ask this. So you have this housing type, but you also have adults only, right?
That's correct.
Okay. So what we want to do for here is, like, how many, we're talking about Fayetteville right now. So how many
Okay.
total units or rooms would you have for families in the Fayetteville?
Well, right now we have 1, but it's a dorm style, so it can support, I believe, 2 families. It has 8 bunks in there.
Okay, so your capacity would be 2 families?
2 families, 8 persons.
Okay, okay.
Maybe not counting cribs if we needed to put 1 in there. But this will change. So with our renovations, we will have designated family rooms separate
Okay,
after that.
okay. So for 2 families or two units, you would, or it's really right now though, it's 1 unit, am I correct?
It's 1 unit.
Okay,
Yes.
okay. And you said, now you might not know this might be something that you might need to get with your supervisor about, or it might be something, because I know that it is not designated, like it's available, but not designated for 18 to 24 or 25 years and older. But how many people, you said 8 could fit in there, right?
Correct.
So typically, would that be 2 adults? And 4,
Unknown, it could be 1 large family with 1 adult. It could be 2 families with 2 adults. It could be,
okay,
that type of thing. Of course we don't. Yeah. So usually it's like the single moms that are housed together,
right,
not normally a mom and a dad and then another mom and a dad,
okay. So for example, so right here, we know that you, in this 1 unit, you have a total of 8 beds available.
Correct.
Okay, all right.
At
So,
least I hope that's correct, if my memory serves me.
right. So this is just an example of how you can.
Okay.
And it might be something that you need to ask Captain Robinette, like, how do you want me to put this capacity piece in there?
Right, and I know the shelter directors are going to watch this later, so I don't want to, they're going to come after me if I get all this wrong. Just,
Right. So, I would defer to Captain Robinette.
okay,
And so if you see here, this is your total year-round capacity. So the surveys that you complete for those that are in your shelter on the night of the 24th, we're going to put in here. So let's say on the night of the 24th, for your unit that has children and adults, you had one adult that was 18 to 24. You had one adult that was over 25, and let's say you had this adult had 3 children, this adult had 3 children, and so that gives us a total of 8. So you
Okay.
had and it's one unit that was occupied, right?
yes,
This is the most we can handle. We have one unit designated for that. So that unit was full on the night of the 24th, and it was full with these folks in these categories for a total of this. Does that make sense?
yes.
Any other questions, anyone, about how this works? Okay, so now we'll just go down for yours. Kim, what is your capacity for? Do you have adults 18 to 24, adults 24 and older, or do you just have a total number of beds?
We have a
adults.
total number of beds. We don't separate by age.
Okay. So how many beds or
We,
persons?
we separate by gender, of course, but
Right. And so when you complete those surveys, that's going to give us all of the demographic information
Mhm.
that we're going to be able to input into HUD about these people over here that you actually had in the count. So for example, how many people, what is your capacity? This is your total year-round capacity.
And let's say it might be off by 1 or 2, but let's say 28, and that's not counting any overflow, any cold weather or anything
Right.
like that.
That's your total year-round capacity beds.
And that is just the shelter, not counting our drug rehab participants that we house at the same facility.
Right. And the drug rehab participants would not be reported in the housing inventory count because they are not the primary, they don't have to be homeless to enter that particular program, or that's not a requirement for entry. That's
I might actually be off a little bit because I can't remember. Let's see. I think it's more like 20 because we already counted the family room.
okay. So 20 here. Right. Is that what you're saying, Kim?
Yes.
Okay. So that's the capacity for total people that you can house. Now on the night of the, I'll have to change it because that's not spelled correctly. I apologize. So on the night of the 24th, let's say you had 5 adults 18 to 24 in there, and you had 14 that were 25 and over. So
And is this information going to come from the PIC count surveys?
Yes. I'm sorry, 5 and 14, which would be 19, right? So that you are correct. So these numbers are just a total of your surveys. So if you had 19 people in there on that night, you had 5 adults, 14 5 adults that were 18 to 24 and 14 adults that were 25 and over. So, and then the demographics, like you said, we will pull from your surveys and that will be included in your PIT count. And the PIT count numbers and the HIC count numbers have to match as far as how many is in there, because they look at what's your capacity. So for example, if we had 16 here, this would be 21, right? So the HIC would say it's not possible for you to have 21 because you only have a capacity of 20 over here. Does that make sense?
Yes.
Okay, so we'll put that. And then see these numbers. So we have a capacity of 20 and we have 19. So what we would do is we would divide, or what they do in their little formula thing is we'll take 19 divided by 20. So that's 95% utilization rate. Okay. And so you at your facility do not have any space for only children, right, under the age of 18.
No, only families.
Right. Okay. Now, and then, so the next thing, let me go back. Any questions about this as far as the household type, what information you put in here and where you put it?
The units then would be the program as a unit, right?
Right, because
You're looking at the family room as a separate program unit.
right. So you have congregate shelter at one site, and we'll go down here. So next it asks you, what is your housing type? So yours is a single site, a site-based single site, right? So that's why you only have one.
And for Seven Hills, for our dorm, that would count as one unit, not 16, right?
Well, actually, because they're separate units within it, aren't they?
Yeah.
Yeah, so you would count those as separate units for you.
Oh, okay.
Okay. So you would be, even though you would still be a single site-based single site, but it's all provided at one, but you have different units within your site, right? So
Yes.
it's not like if you had all 16 people living together in one place, like they do at the shelter, then it would just be one.
Okay. Okay.
Does that make sense?
That makes sense. Thank you.
Okay, yeah. And so right here, Kim, is where we will put the overflow beds. So this is for emergency shelter projects only. How many overflow beds are dedicated for this project? So how many overflow beds do you have for Fayetteville?
Oh, that's a good question. Let me just take a little look here.
Or this is just an example. We can just say, let's say 30. It doesn't have to be a correct number.
I think that's pretty close though,
Yeah.
anyway. And then, yeah,
Mhm.
then we have some for women that are less and some for men, which is more.
Right, okay. So now we're going to go down to beds that are dedicated for subpopulations. Some of these are new, were not included last year. So one thing to be mindful of for this section is that they're dedicated only for these populations. So you might say, well, I serve veterans that are 18 to 24, but you would only include this number here if your project only served that particular population. So like for Paul and for Matt, we have a number of any other veteran. So yours would probably go here. And then our domestic violence survivors, your total number would go there. And if for this particular section, you are going to include all household members. So if you have a family of 3, you're going to include adults and children. Does that make sense?
I've got a question about the subpopulation. So if I've got a veteran in one of my PSH units, am I just counting? I wouldn't count that as a reserved bed. It's not necessarily reserved for veterans in the future, right? So I wouldn't need to fill that
Yeah.
out.
Right, you would not count it here. This is only for those that you have designated. So for example, Tanya and Rachel only serve domestic violence survivors. So they would put their total number there. And that's going to be their capacity number. We have some permanent supportive housing projects that only serve chronically homeless. So they're going to be here, number of any other chronically homeless person. So
Okay.
they only serve chronically homeless. So they're going to put their number in there. Does that make sense?
Yes.
So do we only fill it out if all of our numbers are based on one of these subcategories?
Correct, correct.
Okay.
That's why I said for like the domestic violence programs, they would put a number because they don't serve anyone else that's homeless other than domestic violence survivors. Those that are chronically homeless in some of the supportive, I know the city of Fayetteville has projects that only serve chronically homeless persons, so they'll put a number in there. And then for like Paul and Matt, they're going to serve, and Paul, Matt, I would ask you to kind of chime in here. This is a number of any other veteran. Do you have any programs that are specifically targeted for veteran youth?
No.
Okay. Yeah, so for your programs, you're going to use this here because you don't serve anyone else that's homeless other than veterans, correct?
Correct, all veterans.
Right. So your numbers would be in here, but projects like Seven Hills, the emergency shelters, New Beginnings, you serve all homeless, right? Or in different projects, you have different criteria, but you don't serve specifically these projects. Does that make sense? Oh, you only enter numbers in here if this project only serves that population.
So if for our permanent supportive units, they chronically homeless is a requirement. So I would put 8 next to that.
Yes,
Okay.
if your permanent supportive housing project only serves chronically homeless persons, you'll put that number in there.
Okay.
Whereas, like, that's why we ask that you fill out a separate form for each project, because your transitional housing project, that might not apply.
Okay, that makes sense.
And so also HUD asked us for information about additional populations, but in this section, we only want adults. So the number with serious mental illness, and they asked that they be diagnosed and documented to have a serious mental illness. The number of substance abuse disorders that are diagnosed and documented, and the number with HIV or AIDS. And these are only adults only. And up here in this particular section, it's include all household members. Any questions about that? And so down here, this is where these are all the funding types, and you check all that apply. So for example, Kim, do you know funding sources for your emergency shelter in Fayetteville?
We do ESG, EFSP, and private funding comes through some as for the main part of our funding.
Okay, so we're going to do EFSP and
ESG.
okay, so up here, another question that is separate, is your emergency shelter funded through ESG, regular ESG, and or ESG CV or COVID?
Both.
Okay, so you're going to check both because it's funded through both of those. And then you have other sources. So you have ESP and private funding. For HUD, we don't necessarily have to include the information for private funding, but if you will add that in there, you don't have to say who the private funding is from, but it would really be good for us as a COC to know how much private funding is supporting our projects. Okay.
Usually all of our matching ESG funds comes from private funding.
Mhm. Yeah, because like your regular ESG has to be matched dollar for
Yes.
dollar, correct?
Mhm. Yes.
Okay, so what I'm going to do for a moment is I'm going to stop share and ask for questions or comments. Does it make sense? Do you have questions about how to complete or?
On the funding sources, we have so many different grants. Do I just need to list the grants that are specific to like paying rent at the shelter or any funding source?
The funding, so each of the forms are project specific. So if it is your emergency shelter project, it will be funding that supports that. What grants do you have? You'll report what grants support that particular project.
Okay, and it did say state and federal, so I don't need to go into the need to list all the private grants that we potentially get.
No, you can just say, you can just put private funding there.
Okay,
Yeah, that way, the reason I said that was because like HUD asked us to report on like state and federal funding that supports your projects. We don't have to report private funding, but it would be good if you can just put private funding in there if they also support that project so that we can see how much private funding is also supporting projects in our region.
okay, thank you.
Mhm.
That'd be a whole long list of all the different grants we get.
Right, right. And so I know we're about 15 minutes till. I was wondering if anyone else would like to go through and do an example right quick. Or do you?
One thing that kind of tripped me up on that form is that like on the where it talked about the housing type, it was like adults, at least one adult and at least one kid.
Mhm.
And then below that was like only adults. And we're not set up that way. It's like if you're a victim and you have kids, come on in. And if you're a victim and you don't have kids, come on in. So we don't have them designated as families only or singles only.
Right. So do you, it sounds like you primarily have what we would call adults, family households. So
Yes.
you do take some singles, but you don't dedicate singles, right?
Right.
So my suggestion for your program would be to report everybody up here. And see, I'm sorry, up here, I apologize.
Okay.
Because this right here will break down how many you have on this particular day. So,
Okay.
so your capacity total is what? Do you know in your?
Well, like 10 rooms currently.
Okay, so you have, okay, designated for people. Okay. And how many people would you say that your capacity would be? I remember it seemed like last year you had like a capacity of 55 or something like that. Does that sound reasonable?
No.
Okay.
We do up to 10 adults and however many kids, which I think would probably be max maybe 30.
Okay. Okay. So we'll do 30. Okay. So over here, what you will do is you will, on the point in time date, you will put how many people were adults 18 to 24 were there on that night. How many children of those 18 to 24 were there? How many adults 25 and over were there? and how many children of those 25 and over were there. And then we would total that.
Okay.
Does that make sense?
Yeah.
Okay, good question. Thank you. Any other questions?
When is this due? I mean, we're doing the point in time on the Thursday, the 24th. So do we need to get all this to you on the 25th?
No, we don't have to report it that quickly. As soon as you can get it done, that's great, but it might take some time. You might have some questions. So
Okay.
like a week later would be wonderful.
Okay.
And if you need additional time, then reach out to me. Okay.
Okay. Thank you.
Any other questions? Okay, I'm going to stop recording now.